So they're the largest phytochemical compounds that you find in most strains of cannabis, but they have very divergent effects, both pharmacologically and what they do in the brain. So THC and CBD have been the main focuses of our research in cannabinoids over the past 15 years or so. THC is believed to be the primary psychoactive compound in cannabis. So THC binds primarily with cannabinoid receptors, not as strongly as synthetic agents, but it interacts primarily with the cannabinoid receptors and is believed to underlie most of the rewarding effects of cannabis. And it activates things like the brain's dopamine pathway, which is believed to be responsible for its dependence-producing properties in some people. Now, CBD, on the other hand, is a lot of our research has shown that it has almost the exact opposite effect from THC in a lot of different brain areas. So we found that CBD can actually inhibit dopamine, and it can actually block a lot of the effects of dopamine activating drugs like amphetamine, which is really interesting because you've got these two different phytochemicals in the same plant that are actually producing opposing effects on various neurotransmitter pathways. And we even see this at the molecular level. So for example, THC will activate certain molecular pathways that are associated with pro-psychotic effects, and CBD will actually block those effects of THC, or will actually produce the opposite effect on the same pathway. So it's really this interesting sort of push-pull relationship between THC and CBD, and it's quite fascinating from a neuroscientific point of view.
So when you say that something, when a drug can cause a pro-psychotic or psychotomimetic effect, what does that mean, basically?
Yeah, I mean, so it means quite a range of different things, sort of depending on how you're framing the question. So from a neurodevelopmental point of view, exposure to THC has been shown to increase the risk of developing symptoms of psychosis and schizophrenia in some individuals that have certain predispositions to those disorders. But acutely as well, it's been shown both in human studies and in animal models that THC can basically mimic a lot of the psychotic symptoms of schizophrenia, most of the sort of the positive symptoms of schizophrenia. So things like feelings of paranoia, anxiety, hallucinations in some cases. And it really sort of depends, it's sort of a dose-dependent effect. So the stronger the levels of THC, the stronger the activation of that cannabinoid system, you get sort of stronger activation of these schizophrenia-related symptoms.
I see. So is that common for a drug to have that kind of dose-dependent effect? And what do we know about sort of the dependence of THC's effects on dose with respect to things like anxiety or like memory impairment?
Yeah, well, actually, it really does depend on the drug. So THC and cannabinoids in general are quite interesting because they're generally biphasic. So some of our research has shown that the effects of CB1 receptor activation, which is the major brain cannabinoid receptor, has a very strong biphasic effect. So we've shown that if you activate CB1 receptors in an area of the brain called the prefrontal cortex, there's sort of this dose range where you can produce hyperactivation of the dopamine system. So that's through a pathway going from the prefrontal cortex down to the midbrain, which controls the dopamine system. But if you go much higher, if you can sort of flood that cortex with cannabinoid receptor activation, you actually blunt that response, and this can lead to symptoms that are associated with anhedonia or blunting of emotional processing and sort of a shutdown of the dopamine system. So there's definitely this biphasic dose response curve associated, especially with THC. We haven't really seen that with CBD, which is interesting because CBD acts through a different receptor pathway than THC. But THC most certainly seems to have these sort of biphasic effects on how it modulates dopamine, for example, and then how it can modulate, sort of going from producing side effects like paranoia to relaxation. It really depends on the dose, and it also depends on the individual's history with cannabis. So how much history have they had with the drug? What is the state of their central cannabinoid receptors? Have they been sort of desensitized after years of use and exposure to cannabinoid drugs? That can also determine what your initial reactions are going to be to cannabinoids in general.